Hello and welcome to CG News. I'm very excited today to introduce to you leading professor of cancer, Professor Karol Sikora. Welcome, Karol.
Thank you.
Karol, we've talked many times in the past about cancer and about lockdowns, and today I'd like to talk to you about censorship, because very recently you posted a tweet out about masking children, and that was about a study which had been carried out by experts looking at the risks and benefits of masks on children, and it found that it was all risk and no benefit. So in fact, masks harm children and did no good in stopping the virus. It was a big study. It was published. But what happened to your tweet? You posted it on LinkedIn. Can you tell us what happened?
It was deleted, and I was sent a polite message saying this is against the rules, basically, of LinkedIn. Clearly, what's been very interesting with the pandemic, it's the first time in a long career in medicine and medical science that I've seen censorship of something. And when you look back, a lot of people were censored. The two key areas for censorship were what we call the non-pharmacological interventions for COVID, the masking, the distancing. You weren't allowed to criticize that. The second area was the whole vaccination program, whether it was necessary to vaccinate children, to even still to this day, because I'm so old, Lucy, I get invitations to go and have a COVID shot now. I just bin them. I know there's huge amounts of money involved, both for the drug companies that make the shots, £28.50 per shot, and for the GPs and the pharmacists that administer them, another £25. So there's a financial incentive to do something rather than do nothing. But show me the evidence that even at my great age, I'm going to benefit by having a sixth booster shot of COVID.
So did you see any other examples of censorship during that time? And you say it happened a lot. Do you have colleagues who were censored?
Absolutely. And there were the two key areas, criticising non-pharmacological interventions and vaccines. I gave a lecture at Imperial College on the cancer course, which I do every year, 9 o'clock, the first lecture, the week's course. The students are half asleep, I tell you, at 9 o'clock these days. They just lie on the benches sleeping. And the girls are putting their makeup on. What is changing in the world here? When I was a medical student, we were keen, But seriously, I gave that. Normally they put the lectures on Facebook. And because it was about cancer and it was during the pandemic, and I talked about the problems of lockdown resulting in late-stage presentation of cancer, for some reason, it triggered an algorithm at Facebook and it was removed. But it was put back within 24 hours after I objected to it being removed. And I think there was oversensitivity to any criticism of public health measures. And if you remember, those people from the public health who are the lowest grade of doctor out, I think in some cases, appeared regularly with these frightening suggestions based on no evidence whatsoever. And I think we were very critical of that. And
frightening suggestions, what about the spread of the virus and the death toll, the potential death toll?
Exactly. Right. And the mainstream media portrayed what was going on in Italy, especially just before lockdown here. People on ventilators everywhere. It was all going to change. Guys in military camouflages building hospitals that were never used. I mean, it was ridiculous. Excel in East London, just beyond Canary Wharf, was a 200-bed hospital built by the military in the conference centre there. And was it necessary? Absolutely not. Nobody went there. They had a token few patients to show they used it, but there was no need for it. And the other problem, how was that well thought out? Because where would you get the staff from? You'd have to take the staff from existing hospitals. So rather than, if you really needed to put beds up, extra beds, put them up in the corridors or in the outpatient clinics and so on in the same hospital, because you've got the staff there and the backup, which you don't have in a conference centre in East London.
Well, there was a virus. It was described as novel. There was a lot of excess deaths. Is there some justification for taking control of the narrative? I mean, is there, at the time, for example, I know you were censored very recently on LinkedIn about that mask study, which was a proper study, but at the time, was there some grounds for sort of trying to get everyone to behave in a certain way?
There was, and that's the problem, the risk assessment. But I got the feeling people enjoyed the whole idea that you could control society a bit. The politicians enjoyed it, the public health people enjoyed it. I don't think the police enjoyed it particularly. Chasing people with a cup of coffee sitting on a park bench is not exactly serious police work. They'd much rather chase criminals, I guess. But I think, it was this criticism of anybody that questioned the narrative. And my problem was I could see lockdown and the consequences of what happened to the NHS and the psychops about save the NHS, stay away, stay home, all the rest of it, meant that cancer patients didn't get diagnosed early. And as we all know, the later the stage of the cancer, the more it spreads, the poorer the outcome. However good the treatment, you're going to get poorer outcome.
So, I mean, we know from FOIs and from leaked emails that big tech colluded with governments around the world, particularly, I think, in America, to take control and create this censorship. Do you think that also led to people self-censoring? Do you know colleagues that didn't speak out about what they felt because of that?
A lot didn't speak out. And those that did, I mean, I was just amazed about at the anaesthetist at King's College when Rishi Sunak visited him, or Boris Johnson, sorry, I'm going back in time. So many prime ministers of the last 3 years. Boris Johnson visited King's and he said, I'm not having the vaccine. And they actually didn't make it mandatory for health service workers to have the vaccine after that. It was going to be mandatory, but he spoke out and he got away with it. I was surprised. I mean, that was almost like high treason saying that at that time. And the system backed down because they couldn't produce the evidence that it really had such an impact on the whole thing. I mean, the trouble is, as in your previous question, Lucy, you're quite right. You don't know at the time how bad it's going to be. It's easy for me to sit here at the end of 2024 saying, well, it wasn't really that bad. It was just a winter virus. And why do we make a fuss? Old people die with winter viruses every year. That's called winter pressures. They fill the wards, they fill the corridors, the emergency room, and quite a lot of them die. And the average age of death from COVID was 81, which is the average age of death in the UK. So really, the impact on life by COVID was not as significant as the impact on life by the delay in cancer diagnosis over a long period of time. I think the other thing to add is the capacity in the NHS is not there, and its chances of recovery from the onslaught of COVID are much less than European systems, than North American systems of healthcare, and that's a long-term issue that needs solving by the politicians.
Some people would argue that the measures we took reduced that death toll, and they would argue that it was that bad because we had a huge excess mortality. But then other people might just say we don't know what that mortality was really about because we had tests that were kind of very overly sensitive to people's whether they'd had a virus before, and we had people who were neglected in care homes. It's a messy picture, isn't it? Do you think?
It's very messy. I mean, the concept was flattening the curve. The idea was that the infection was coming, you couldn't prevent it, you could reduce it, and you could spread it over a longer period of time so that at any one time there wouldn't be so many people that are desperately ill that would need to be in an intensive care. That was the idea, just flatten the curve. And that seemed logical, I have to say. And that was led to all the measures, the non-pharmacological measures. But it went on too long and no one really knew what they were doing. You remember the Christmas of 21, the plan was nearly missed Christmas. And at the last moment, they were going to put a lockdown again at Christmas, cancel Christmas. And that didn't happen, thank goodness. And, the trouble, and the system didn't get overloaded. And if you remember, the other thing that was interesting, people went around hospitals, rather naughty people, videoing with their phones empty hospitals, empty hospital wards, staff standing idle, dancing in the corridors, all that sort of thing. And it was true because everything was cancelled. All cold surgery was cancelled, cancer operations were cancelled. People had nothing to do. And the only people that came in, with a few exceptions, Lucy, were old people. And they come in anyway in winter. And that's the nature of winter pressures.
Tell me about the impact on cancer care. I mean, you just mentioned it earlier, but you knew of people whose delayed diagnosis led to poorer outcomes or poorer treatment and death.
Yeah, the four common cancers, lung, prostate, breast, and colon, the chances of survival for stage 1 cancer, when it's confined to the organ that the cancer arose, is over 90% in each case. You will be cured, 90% probability, which is not bad with modern treatment. If it spreads to stage 2, to the lymph nodes, or even worse, to stage 3, beyond the neighboring lymph nodes to distant lymph nodes, the chances drop from 90% to 45% for stage 2, and then down to less than 20% for stage 3 and 4. So any delay causes what we call upstage migration, shifting the stage to a higher stage and therefore a poorer prognosis. And that's for the best treatment possible. The delays were not just in the diagnosis, were also in getting treatment and also in accessing the whole system. Remember, you couldn't just walk to the GP surgery. It was like Fort Knox there. They'd erected barriers, do not enter. I remember collecting a prescription for a neighbor, and they shouted at me at the door because I had dared to walk in, you know. It was just crazy, and the psychological impact of it was just appalling. And my grandchildren wouldn't kiss me and that sort of thing. They don't kiss me now, but they wouldn't touch me. They didn't want anything to do.
Didn't want to harm you.
My
But
wife.
you were incredibly brave, and perhaps one of the reasons why we didn't lock down that Christmas was because of people like you speaking out and showing that there wasn't just one science or one view. Why did you feel that you could be so brave? And did you get attacked ever by people?
I didn't get attacked by professional colleagues, but other people were critical of what I did. I got within the profession, I think everybody knew we were overreacting to it, but no one knew how to handle the whole thing. And certainly the cancer way was the good way because, I'm allowed to speak up for cancer patients because I'm an oncologist. If I don't, who is going to do that? The cardiology community was strangely quiet. I mean, people didn't get stents put in for heart attacks during that period because they didn't access quickly enough. They remained quiet about it. But I think the cancer community could see what was going to happen. And it seemed essentially unfair because if you look at the number of life years lost from COVID and cancer, the cancer patients are much younger than 81 on the whole. So if you get an extra higher cure for cancer, you're going to save more younger lives than you are if you do something for COVID. So
Yeah.
It's a balance.
Yeah, life years lost and trading lives, I think I remember
Exactly.
one oncologist said. Do you feel that the inquiry now is going to really tackle these issues and look at the censorship and perhaps we might learn lessons?
I think the inquiry's gone on too long. I mean, it's not finishing for another year or so. I mean, this is not the sort of inquiry we need. It shouldn't be run by lawyers. It should be run by scientists and physicians. And we need that's exactly what you say is what we need. We need guidelines for the future for pandemic. And I don't think we'll get anything that's useful. We're not interested in tittle-tattle about whether Boris opened a bottle of champagne on his birthday in number 10. This sort of total tittle-tattle. Boris will be long forgotten before the next pandemic. So the thing that matters is the science behind what happened. They used to say, follow the science. We're following the science. Well, tell us what the science is going to says about how we handled it. And I don't think we're going to hear that because it's not constructed in that sort of way. It's a legal inquiry. It's the sort of thing you have after a train crash when many people are killed or a disaster in a hospital where, someone's gone around murdering people in the hospital. And that's not the sort of inquiry we need for this. It's got to be an open discussion and with no censorship. But, I'm afraid there's still the nutters like me are branded nutters because uncensored because we have one view and it's not following the party line or the narrative, as you'd call it now.
Well, I did approach LinkedIn to ask them why they censored that paper, but they haven't replied. But one presumes, it broke the community policy guidance. So I had a look at that as well, and I can't see anywhere except that it might have been deemed as misinformation. But it's just somewhere it's picked up in an algorithm or a moderator or. Yeah.
I suspect it's non-human. I suspect it's a computer that's searching for certain things and it finds it, and that's it. I mean, do I make a fuss? Of course. Now, what do I care? It's deleted from LinkedIn. I mean, it's not important. But I think it's the more important thing is you have censorship and. From people that really don't know that much about things. Ultimately, artificial intelligence is doing the censorship. So if you have it for that, you move forward in society, you'll get more and more of it as we go on. So we'll get the same stuff, just like mainstream media gives you the same approach, whatever topic it is in the news.
How do we avoid this in the future? So, when the next pandemic happens and we do need people to behave in a certain way, we don't want people putting out things which are misleading, do we? I mean, what do we do about that? Have you got any ideas?
I think that's the problem. I think you have to let people speak, let people have extreme views. And there are people out there with quite extreme views. Some of my colleagues have extreme views, much worse than me in terms of towing the party line, both in cancer and in various other disciplines about masking, about vaccines and so on. We have to allow them to express the opinion. Why not allow? You're allowed to express the opinion about the treatment of breast cancer, for example, whether we use chemotherapy before or after. It's a reasonable topic for discussion. Why not? Let's discuss some of these and come to a consensus. And the consensus may change with the time and with the disease. So I think openness is the key for the future. This is what happened in Sweden. I mean, it's exactly what happened there. I had open discussion. It was up to you. You could lock down yourself. You could go out. You could get a drink in the harbour. I had a drink in the harbour when everything was shut in the UK, in Stockholm. And in the sun, it was such a rare treat in the summer of 2020 to sit in Stockholm drinking a beer. The price was high because beer in Stockholm is even higher than in London. Twice the price.
So do you think now this is now the playbook for future pandemics, that we will have censorship again, we will have lockdowns, we will have vaccines and vaccine mandates? Do you think this is going to be the path we follow?
People are going to have to get much better evidence that we need it before we implement it. I think the politicians, whatever party they are going to want better data. And I think that's probably what's going to come out of it. We can't do things like lockdown, which impose restraint on the public without good evidence that it's really necessary. And I think we have to say that it wasn't necessary in the way it was introduced the last time.
Yeah. Fantastic. That's absolutely brilliant. Good to see you, Karol.